Om Sri Sai Ram. I offer my humble salutations to the lotus feet of our loving Bhagavan, respected elders, and my dear friends. A very loving Sai Ram to you all. I thank Bhagavan on one hand and the organizers on the other for giving me this opportunity to come here today and to speak to you all. I thank Dr. Kalpalata for the introduction which she made, but may I say with all sincerity that the ideal for each one of us is Lord Hanuman. Next slide. When Lord Hanuman was asked by Vibhishana in Lanka, "Who are you?" he said, "I am a servant of Lord Rama." When Lord Hanuman himself, with so much of bhakti, shakti, everything, when he could say he is a servant of Lord Rama, I feel very sincerely that I am, and maybe all of us, we are servants of God, our Divine Master, nothing more, nothing less. It took me some time to figure out the topic on which I should talk to you all today. Your Samiti head, Mr. Nagarajan, was very magnanimous when he said, you can select, you can decide on whichever topic you want to speak. So I reached out to our respected Dr. Kalpalata Garu for advice, and she told me that you speak on this project of Bhagavan Sri Sathya Sai Mobile Hospital because it is not really known to most of the people here. And may I tell you, to even many across the world, our own organization, a service which is very dear to Bhagavan's heart, and a service which really has provided now the model for the government of India and also the different state governments. I said, yes, it's a good idea to speak, but still I was not fully convinced because my dear spiritual friend, spiritual brother, Mr. Roman of the Indian Foreign Service, you might have heard his name, he used to always tell me that whenever you speak, two conditions should be met. First, it should be useful to you. Second, it should be useful to the audience. So I was wondering what is the relevance, what would be the relevance of this particular subject for you, placed as you are so far away from Puttaparthi. But then, I instantly recollected the year 2009, when Bhagavan sent me to Los Angeles for an international conference arranged by the overseas doctors. And at that time, Swami told the head of the overseas doctors that I don't want to send the super specialty hospital head or the general hospital head. I want to send the head of this project, because don't think it is only India, being a land of villages, this sort of an outreach rural health service is required. Across the world, there are so many countries in which there are communities which are cut off from the mainstream and where delivery of healthcare becomes a big challenge to the healthcare planners and administrators. So I felt a little more convinced. And one more clarity which I got was, as you know, in all Bhagavan's services, there are some common principles, methods, systems, procedures, which are applicable to any seva for that matter. So I thought I would ponder upon these aspects, especially one aspect which was made at the heading, innovation. This principle of innovation, as you all know, is common to any service, and we need to do that. Especially, for example, you are placed in land where the law of the land doesn't make it easy for you to do especially medical seva. So overall, my talk today will be under 3 distinct and specific headings. Firstly, a descriptive portrayal of Sri Sathya Sai Mobile Hospital. And then I made a separate heading, probably highlighting features of this particular service, which is a service which was directly conceived, planned, and started by Bhagavan, and he was monitoring it on a very regular basis. And in that way, I had the fortune to have the guidance of the Lord of the universe itself on many aspects of this beautiful seva. And the third heading, as I said, what are the lessons which are emanating from this innovative service, which would be applicable to any other service which you may be contemplating to start. So, taking the first heading, as you all know, Bhagavan Sri Sathya Sai Baba is known the world over for his relentless commitment to gigantic projects in the fields of healthcare, education, safe drinking water, services which are provided absolutely free of cost, even now, perhaps unheard of in human history. The Sathya Sai healthcare service, or if I can use the word Sathya Sai medical mission, has passed through 3 distinct and specific stages. In the first stage, way back in 1950, Swami felt that primary and to some extent secondary medical care should be provided absolutely free of cost to the poor and the needy, and that's how we started the Sathya Sai General Hospitals in Puttaparthi and in Bangalore. The medical mission took, I should say, a giant stride in the year 1980 or 81, when Bhagavan suddenly declared that it is not enough if primary and secondary care is provided, even tertiary health care. Tertiary health care means high quality care in the form of open heart surgeries, complicated neurological procedures, urological procedures. All of these also should be provided absolutely free of cost, especially to the poor and the needy, without any discrimination. And that is how started the super specialty hospitals, first in Puttaparthi and then in Bangalore, which even now, as you know, are monolithic monuments of the Lord. But I would say the turning point came in the year 2004. The Sathya Sai medical mission, I should say, took a quantum leap when Bhagavan now declared it is not enough if this high quality care is provided. He said it should be delivered. As you know, there is a lot of difference in the meanings of the words providing and delivering. Providing means the services which are given by a static hospital. Delivery means you yourself reach out to people who may be far away, but ensure that you deliver a quality service. And Swami made the statement, as I said yesterday, I would like to put it in Telugu and then I would translate it. నా భక్తుడు కష్టంలో ఉంటే నేనే వెళ్తాను, వాడు రావాలని నేను ఎదురు చూడు. మీరు కూడా డాక్టర్లు, వైద్యం నారాయణ హరి, మీరు కూడా మీరే వెళ్ళి అనారోగ్యులకు చక్కని చికిత్స చేయాలి. He said, if my duty is in pain and suffering, I don't wait for him to come. I myself go. In the same way, you being doctors, embodiments of Lord Narayana, Vaidyo Narayana Hari, you should reach out. It is not enough if you stay in towns and cities and say, I am doing some good service. No, you have to reach out to these people, the poor and the suffering, and in the process, render a quality service. And he made a very, a unique statement when he said, Nenu deen peru Sathya Sai Mobile Hospital and Pettuna. He said, I am naming it as Sathya Sai Mobile Hospital. It is camp kaadu, clinic kaadu, service kaadu. Hospital lagane aa roju aa gramamlo untali. It should function just like a hospital. You can imagine the standards which the Master sets for us. Now, when we ponder upon the fact that, notwithstanding the fact there is a general hospital, there is a super specialty hospital in the town of Puttaparthi, what made the Lord, whose vision, whose foresight, as you know, is universal, what made him to really start another project another medical project. In fact, some of the administrators there were wondering why this at all. And that can be really understood if you look at the rural health scenario of our country. India is a land of villages. You all know. Gramavasini Bharati we call. 70% of India even now lives in villages. The legacy, the rich culture and heritage of Indian civilization has been built on the legacy of its village culture, whose guiding principles have been, as you know, Satyam Vada and Dharmam Chara. National heroes like Chhatrapati Shivaji, Mahatma Gandhi, and even in our own time, Professor Abdul Kalam, they were all nurtured in the very hearts of these villages of India. But unfortunately, these villages are going through troubled times now. And Bhagavan once remarked, brain drain problem kadu, it is only intellectual loss. Kani grama drain. People, if they move out from villages and comes to town and cities, Swami said, it's a great cultural loss. And India being the torchbearer for humanity in terms of culture, which Swami said is refinement of human nature, the meaning of culture, he said that would be a great setback for this country. So Swami had such a large vision, he started. And even as doctors, for example, or as any rational human being, if we analyze the current rural health scenario, this is to start with a huge disparity. Dr. Kalpalta is very much aware of this. 80% to 70% of our population is in villages, but 80 to 90% of all healthcare facilities, in terms of infrastructure, in terms of doctors, in terms of diagnostics, all are centered in towns and cities. This is a gross inequity, a gross injustice, which has been, in fact, not only done, but going on being perpetuated even now by healthcare plans. To the extent now we have two Indias, a rural India which is deprived, which is denied of even primary care in its fullest extent, and we have an urban India where so much of advancement, so much of modernization in Medicare. In India now ranks in the medical field as one of the top countries. But the fact of the matter is this gross inequity. And obviously, the health indicators, health parameters, what we call the infant mortality rate, maternal mortality rate, life expectancy, all of them, the figures of rural areas compare very unfavorably with that of urban areas. And there's a huge level of ignorance, even now, with all this modern mass communication, so many tools have come. But still, on basic matters of health and disease, believe me, because I have traveled about 15 lakhs of kilometers in my life, I have gone through so many villages. Basic aspects of health and disease is still not known to most of the villages of India. I think it was this pathetic situation which prompted the master, and the healthcare delivery system, what we call, is caught in what I would always say, I make this word to even healthcare planners when I go for presentation, is caught in a tricky triangle, a difficult triangle. One limb of the triangle is the challenges which the government is facing. Some of them are justifiable. The other limb is the reluctance of doctors to go to rural areas, and the base of it is formed by the constraints which villages have, even to access the facilities which are currently available in towns and cities. On the one hand, if you see the government's challenges, India has a very difficult geographical topography. As you know, it's a land of agriculture. So people build village houses around fields. In this way, India has 6 lakhs villages. It's a real big challenge for any government to provide healthcare with this sort of a difficult geography. And not only that, government, as you know, modern medicine is all about technology, diagnostics. Government finds it difficult to transfer this technology to rural areas, install it, maintain it, service it. It's a very big challenge. And the most important factor, which I would like to bring to the attention of the eminent doctors especially who are here, is the lack of integration of primary, secondary and tertiary care. These are words which we use as doctors, but for a poor villager who has a problem, he doesn't know whether he comes under the category of primary, secondary and tertiary. And 70% of the country is left to the mercy of what we call primary health centers, which are rudimentary centers with a single doctor without any diagnostics. And if a poor villager goes with a lump in the breast, she is only told to go to a higher center somewhere in town and city. And in the process, either she doesn't go or she loses the way. There is no system which will escort her to the tertiary center. So there is no integration of these three levels of care. How difficult a situation for a villagers who constitute 70% of our population, you can imagine. Then again, if you take the case of doctors, there is a great reluctance of doctors to go to rural areas and serve. And they are quite justified. Not that I am a doctor, I am supporting them. Because the lack of infrastructure there, it doesn't whet their technical appetite. It doesn't give them that professional satisfaction. So they feel, if they work for a year, at the end of the year, they would have forgotten their subject to a great extent instead of sharpening their skills. And not only that, for their personal lives, especially schooling for their children, things like that, it's not at all favorable. So doctors are to a great extent justified also. And the base of the triangle, the third aspect of the tricky triangle, which I said, is the religious constraints. And these are the four reasons which actually Swami told me why he's starting this mobile hospital. As I said, he said, "Vaadu paapam kooli purchase batuttaru. Aa kooli udurukunte aa roju puttake valle bhojanam kuda dabbu untadu." He said they live on daily wages, and if they have to come to the hospital, they have to forego their work, which means they have to compromise even with their square meal. And he said, women at home, they have to do a dual job in the field and at home. They have no time. Senior citizens, nobody to take them to the hospitals. Many of them don't have money even to cover the transportation charges. And we had mentioned earlier the poor awareness factor on health and disease. So it was a very difficult situation. Even now it is such a difficult situation. And here it is that our master delivered what I would call the master stroke. And what he did, he said the solution for this is rural outreach service, but a quality rural outreach service. Not at all in any way connected to the sporadic medical camps which you see all over the world. I have seen so many medical camps. As Dr. Kalpalata always says, these camps only serve the purpose of making us feel good. But in practice, when you take the utility aspect of it, they really don't serve the purpose. But our master visualized this, he thought about the problem, and then he came up with this beautiful solution of a miracle of all sorts, which we call it as Sri Sathya Sai Mobile Hospital.
కేవలం ప్రేమ చేతనే సేవ చేయండి, బీదలకు ముఖ్యంగా సేవ చేయాలి. ఆ బీదల సేవనే మిమ్మల్ని సంరక్షించేది. రామసేవ అని బీదల సేవనే రామసేవ. కనుకనే బీదల సేవ చేయండి. ఈ బీదల నిమిత్తమై నీ ప్రాణాన్ని అంకితం చేయండి. నాకు వేరొక ఆశనే లేదు. నాకు ఈ బీదల సేవనే ప్రధానమైన లక్ష్యం. ఏమైనా సరే ప్రాణాన్నైనా వారికి అంకితం చేసి వాళ్ళని కాపాడటానికి ప్రయత్నం చేస్తాం. ఈ లక్ష్యం లోపల వెయ్యింటి ఒక భాగాన్ని మీద మీరు పెంచుకోండి. ఇది మానవుడు ఈనాడు చేయవలసినటువంటిది.
Now we move on to the actual details of Sri Sathya Sai Mobile Hospital. And as I said, it would not be just a mechanical portrayal of it, but after making the portrayal, I would try to bring out the beautiful lessons which emanate from this project, which, as I said, are common to any seva, especially a big seva, if we plan in any part of the world. So, coming to the details of the mobile hospital, it's a free rural outreach, comprehensive, high quality, sustained service. That is the beauty of it. Can you believe it was launched on March 30th, 2006? We are in the 20th year. And even after the Mahasamadhi of Bhagavan, it has been going on, it is being delivered, the care being delivered with the same commitment, with the same compassion, with the same quality. And I should very humbly say, in fact, it has improved. As you know, with passage of time, we believe that we should never remain static. Remaining static or stagnant is verily death itself. We need to expand and diversify. No, there's one more slide. Yeah. So as I said, started in March 2006. It operates from 1st to 12th of every month. You may be wondering, why not the whole month? Bhagavan made it clear. Two things he said. 1 day work in the mobile hospital is equal to 2 days work in a static hospital. 12 రోజులు, if you do 12 days, 24 రోజులకు సమానం. It's equal to 24 days. Every hospital will have 4 Sundays and 2 holidays. You should not do more than 12 days. And secondly, we all know that Swami always used to say that I will only start models. Swami said, I have not come to remove all the sickness or the other social problems in the community. I have come to remind mankind of its essential divinity. But in the process, I would create such models which would help my devotees in their evolutionary sadhana, what we call, and at the same time, it would provide the model for the government which is given the mandate by the people and which has all the funds to replicate these projects. Now, when Bhagavan launched this and called me, Swami did not appoint any doctors. Literally, he did not appoint. And for any project, Swami used to assemble all the 3 M's in management parlance, you know, manpower, material, money. He assembles all the 3. But even when the secretary and the gentleman who had the fortune to donate the diagnostic Sanjeevani bus, as it is called, Mr. Rajiv Mahajan, whenever they used to ask Swami, what about doctors? Whereas the super spirituality, when it was started, doctors were all recruited much well in advance. And Swami used to say, I'll give you 1 good doctor. And when they persisted after 2-3 times, Swami, what can 1 doctor do? No, he'll bring good doctors too. And the secret behind that was, as Madam had mentioned, from 1996 to 2004, 8 years, we had done relentless Grama Seva, rural service, in Hyderabad surrounding districts, villages of those districts, and thereby a team of 150 doctors got built up. So this is one of the lessons which emanates from this, that if you want to build up your team strength, you have to generate service first. And that generation is done by the sacrifice of 3 or 4 members who work heart and soul totally for such a service. And when such a service is generated, people rally round. And when people rally round, you should expand it further. Again, people come and join. So when we started the Sathya Sai Mobile Hospital, there were 150 doctors. This apart, Swami, as you know, Bhagavan, God gives us only broad hints. And he expects us. As we were talking yesterday, Swami always says, I have given you common sense at the mind level, intelligence at the intellect level, conscience at the soul. Use all these 3 senses. So Swami used to give me broad guidelines, but how to go about it all specifically he wouldn't tell. But then, drawing from my rich experience in rural service, for that matter, any seva, any project you start, you need to have 2 important, you should be clear on 2 important aspects. One, first is called the operative theme. What is the basis? What is the principle on which you are going to do this service? Of course, the principle is seva, but still specific to that seva, what is it on which you are going to work? This is called the ideology. The operative theme represents the ideology. And this ideology has to be translated into practical action, into a methodology, and that is called the operative strategy. This sort of a clarity, I had it right from the beginning. So the operative theme is like, when we devised, I decided that health, Swami was always insistent, it should be holistic, it should be comprehensive. And since this is a service which is going into the community, penetrating into the community, when you do a good clinical work, a good curative service, you are placed at a huge advantage. You have the tremendous goodwill of people. You are the right people to teach them on aspects of prevention. And then the base of the program, as Bhagavan always used to insist, and yesterday we reminded ourselves what Swami told about spirituality itself. Arogya, Adhyatmikanike, Adharamu Arogyam. The basis of spirituality is health. So the spiritual base constituted the 3rd limb of the operative theme. And when you have this operative theme, automatically your methodology, your roadmap starts developing. So when we come to the operative strategy, the first thing we did was, as you know, it is something like a battlefield. You are going on you are having a war. You should know the strength of your enemies. So in our medical parlance, it amounted to knowing what we call the community disease spectrum. What are all the diseases in the community, and what is the community disease load? Which are the diseases which are more? Unless you have this clear idea, you cannot again develop a proper strategy. So this sort of a classification, my dear doctors, is not given in any public health book. It came out of our hearts, out of practical experience. And one Dr. Ashwini Kumar, who is rated as the Bhishma Pitama of medicine in Andhra Pradesh, he said this classification looks so simple. Like Bhagavan's, the essence of Veda, Swami said, is love all and serve all. In the same way, this classification can be applied to any hospital, let it be even a static hospital, in any part of the country, or the world for that matter. So we classify ailments into common, chronic, intricate, asymptomatic, preventable, and medical emergencies, and this applies to every organ system or every specialty in the body. For example, you take the specialty of ENT, a common ailment is a common cold. A chronic ailment is, in India, children especially have pus coming out, or a chronic maxillary sinusitis. Many of us also suffer. An intractable ailment is, for example, we are talking of specialty of ENT. Somebody has got a vertigo, giddiness. It can be due to a peripheral cause, what we call an ENT cause. It can be because of a central cause from the brain stem. So that is an example of an intricate ailment. Asymptomatic ailment, for example, in school children in India, when we did an audiogram for school children, we found 4% of them having hearing impairment sufficient to interfere with their academic career. So these are hidden ailments, and in public health parlance, we call it the tip of the iceberg phenomenon. That is, most of the disease is actually hidden in the community. They are asymptomatic. So the patient doesn't feel the need to consult a doctor. Preventable ailments are where if you do a good preventive exercise of health education intensively and extensively, the community disease load comes down. So if you take any specialty, you will now list out what are all the common ailments, chronic ailments, and then you devise a strategy how to handle them. Let it be. This sort of a clarity, classification has to be there in any hospital. Then only it would be worth its work, especially a rural outreach work. The second operative strategy, which Swami was especially very insistent was, he said, it is a medical camp car, not a sporadic exercise. It should be a regular, serious, sustained service. And as you know, in medical service, yesterday also we were discussing, an important component in medical parlance is follow-up. And unless your service is regular, serious, sustained, follow-up cannot happen. So what we did, we mapped out the geographical area around Puttaparthi, and because there are so many villages, we identified 12 nodal points, or the base villages. And to each of the base villages, patients come from 25 to 30 villages. It's just a question of walking across the field for them. They need not come to the main road also. This is how this service helps them. It doesn't disturb that daily wages pattern, because somebody can come in the morning, go for his work in the afternoon, or come in the afternoon, go for the work in the afternoon, come in the morning. So this sort of a regularity and fixity, what we call, over a period of time, what it does, it generates faith and confidence in the minds and hearts of the people that there is a healthcare system which will take care of us. And that gives credibility to the work which you are doing. Next.
India has always been a land of villages. Surrounding Puttaparthi, there are at least 1,000 villages within a circle of, say, 60 kilometers radius. Clearly, the proposed mobile hospital could not serve them all. 12 big villages belonging to 6 mandals around Puttaparthi were selected as nodal centers. These nodal centers are within 50 kilometers, making them well suited for a day's visit. Each center would serve people from that village and also its surrounding 50 villages.
So this was the basic way in which we went about. The third operative strategy, which I will list out, is Swami was very particular that the service has to be of a high quality. He said, Vaidya Nipunu Undali. Specialist doctors should be there, skilled manpower. Because normally in medical camps we see that there are a couple of 2 or 3 doctors, general doctors, give some B complex, some Tylenol, do some window dressing, but Swami was totally against that. And hence, right from the beginning, the mobile hospital has been rich in terms of the technical manpower. We have doctors belonging to at least 10 specialties on any particular day, and these doctors work in close coordination. They don't work in tubular compartments, and they integrate their efforts and ensure that an end-to-end solution is arrived most probably by the end of the day. Believe me, I am from Hyderabad, a big city in India. If I want to meet 2 doctors of different specialties on a single day, it is not possible. Either the times would not match or the doctor would not be able. But here is a beautiful situation. Under a single roof, so many specialists are available. Somebody comes with an acute abdominal pain, a physician sees, he feels that the opinion of a surgeon is required to rule out an acute cholecystitis or a cholangitis, and then a surgeon will examine. And if it is a female patient, she is taken to a gynecologist to rule out any pelvic cause, and all of them ultimately decide, let us have an imaging done, an ultrasound done. So an ultrasound is done. Most likely, as you know, the cause of the problem is identified, and if it is a medical problem, the medicines are provided the same day. If it is a surgical problem, I'll tell you what is done. So anyway, having a rich variety of doctors belonging to different specialists is sine qua non for the success of especially a rural outreach service. Otherwise, having gone so far, if you are really disadvantageously placed in terms of availability of the right doctors, the service would not really be useful to the people. Yes, as you can see, some of the pictures of the different doctors in Seva. Next slide. The next operative strategy, this is a very important slide because Bhagwan was very keen on this and it was his master stroke directly. Swami said, having gone to an interior village, you sit there and then you write a paper asking the patient to get an X-ray done in a nearby town like Anantapur or Dharmar. He said, Meer lopala poyaru, vaallani bayata taramestunaru. You have gone inside and now you are chasing them out. He said, Kadu, just as a warrior has all the arms and ammunition, you doctors should have on-site diagnostics, Swami said, to the extent possible. And that is how he gave us that beautiful Sanjeevani bus, which Bhagwan was so fond of, so possessive also. In fact, he kept the keys of that, one key of that with himself. And he used to say, Nabas. And that has, on the one hand, a laboratory, an imaging section in the form of digitized X-ray, an ultrasound with color Doppler facility. You can even do a 2D echocardiogram. And in addition, the mobile hospital doesn't constitute that bus. The bus is only the diagnostic limb of the mobile hospital. The actual mobile hospital is based in a civil structure in the village, usually the village school. The school is given a holiday that day and they work on second Saturday because the school children and the school teachers also benefit from this healthcare service. So each of those rooms, 5 rooms, specialty rooms which we create for the 15 doctors in service, has again all the diagnostics that are required. Let it be the eye doctor's room or a gynecology room, because diagnostics, whether good or bad, as you know, is modern medicine. And if you don't have diagnostic, doctors are at a huge disadvantage, and at the end of the day, they would feel really satisfied. In fact, when we talk of doctors coming for Seva again and again, this is one strong factor which motivates them, that at the end of the day, by virtue of the diagnostics available, the cross-consultation available, they are able to come to a reasonable conclusion and concretely benefit at least a few patients. This motivates a doctor to come again and again for service. I have seen as a doctor that is the secret of the mobile hospital having 300 doctors, even after the Mahasamadhi of Bhagwan. And in this, for this purpose, we are hugely helped by technology. Technology has really helped us so much. We have what's called portable, sleek variants of many of the equipments. For example, if a patient has undergone a valve replacement, we do a test called prothrombin time because he needs lifelong anticoagulants. For that, there's a small handheld machine, electroencephalogram, which my own daughter is a neurologist, and is becoming a neurologist. Electroencephalogram also comes in a portable form. It has jammers, so that you can do it even in a village room without the disturbance of sound. So technology has helped us in this process, and I'm so glad to tell you that always we are on the lookout. How will we upgrade the technology that is available? Next slide.
Medical baths, which besides having exclusive cabins for X-ray, ultrasound and lab tests, has an ophthalmic unit too, with equipments like autorefractometer, slit lamp, albanation tonometer and so on. All of this enable complete eye checkup.
This kind of equipment is generally available in metro cities and advanced eye clinics. And serving these villages and serving in our mobile hospitals gives me a different level of happiness.
Yeah. The next operative strategy is, as you know, diagnostics like CT scan, MRI scan, they are big machines, they cannot be carried to a village. So this is called off-site diagnostics. Now Swami was particular that you should do a wholesome solution. You should not wash off your hands by telling them to go to higher center. So we devised a mechanism for this off-site diagnostics, CT, MRI, and we take the appointment for the patient. The patient has to go only once, and we are, by digital means, we are linked with the super specialty and the general hospitals, the mobile hospital. We view the reports online. So, as far as possible, Swami gave us an important guideline. Patientలను మీరు తిప్పొద్దు, don't make them run about here and there. So that is how we have also created provision for off-site diagnostics. Now this is a lesson not only for us, but even to the government, which you would see in the end, the suggestions which we have given to the government have really been received adequately and properly, and now it is for Swami to put his final divine hand to see that it happens, the replication of Swami's mobile hospital across the state of Andhra Pradesh. The next operative strategy is provision of drugs. Swami said, such specialty doctors, you go do all tests, and in the end, if you give a prescription, it's a waste. They will not be able to buy the medicines. They can't afford, they don't have money even for a square meal. So he said you should have all the medicines as far as possible with you. So we have a rich formulary of 160 different medicines, and I'm so glad to tell you that, as you know, we are all in a COVID-2 situation. The modern ailments of diabetes, hypertension, stroke, heart disease, chronic kidney disease, 50% of the outpatient or inpatient in any hospital anywhere in the world are these patients. And for these patients, we decided that we'll give them 1 month medicine till we reach out to the same nodal point the next month. It's a dream come true situation for them. An MD doctor examines them, does the necessary tests, and gives them 1 month medicine. But in this process, you would then wonder if the whole district of Anantapur comes to you, how will you handle? Swami made it very clear that every organization can have a demarcation. Because I asked Swami, in Sathya Sai Ideal Healthcare, it's written that there should be no discrimination. So if suppose some patients we don't give, Swami said, adi discrimination kaadu, adi demarcation. He said any organization will have a range of operation. And he gave a very simple example. Auto undi, an auto rickshaw is there, a 3-wheeler automobile. దాంట్లో 3 కూర్చోవచ్చు, 4 కూర్చోవచ్చు, 4 people can sit, ఇంకా 2 కూర్చోవచ్చు. కానీ దానికన్నా ఎక్కువ మంది కూర్చుంటే ఆటో కదలదు, లేకపోతే పోయే ఆటో పడిపోతుంది. If 4 people sit, the auto won't move forward. So he said there's nothing wrong, we have a demand. So what we have effectively done is the base village and surrounding 8 villages, they get the benefit of 1 month medication. For all the others, consultation is not denied, investigation is not denied. We give them 10 days medicine and tell them to have a follow-up at their own ends. Because if they come from far off distance, the compliance rate is also poor, what we have observed. So the next operative strategy is, as you know, in an outreach setup, we realized that there will be 10 to 15% of ailments which cannot be treated there. And this applies especially to surgeries. Because Swami said, మీరు హాస్పిటల్ లాగానే అన్నీ చేయాలి, డూ ఎవ్రీథింగ్ లైక్ హాస్పిటల్, కానీ మత్తు మందు ఇచ్చి చేసే ఆపరేషన్లు చేయకూడదు. He said, don't do surgeries on the field. So we need to have a viable backup support, a base hospital support. And we are fortunate in that we have the Sathya Sai General and the super specialty hospitals. And as Dr. Kalpalta was mentioning, now I am the head of the General Hospital also last 6 years. So I am able to integrate the care of the mobile hospital, the General Hospital being at the center point, and even the super specialty hospital. Like for onco surgeries, thyroid surgeries, Dr. Chari knows that sometimes post-op they may need a tracheostomy if it's a very big goiter. So for such cases, we get them operated in the super specialty hospital. It is the mobile hospital doctors, the mobile hospital patients, but the infrastructure is the super specialty hospital. So this sort of an arrangement is also possible in the government. How it is possible, we have explained to them.
The operation theatre is reserved for a few days in the Sri Sathya Sai General Hospital, and complicated surgeries for the villagers are done here. That truly and completely defines the word comprehensive, isn't it?
Yeah. The next operative strategy, as we all know, IT leverage. IT has really helped us, as you know, for a good work. It is really a sort of a miracle. So for integrating these three levels of care, either in terms of provision of higher level of diagnostics, because as I said, 10 to 15% of patients are those who require higher modalities of diagnostics or medical management or surgical interventions. And for this purpose, IT has really come in handy. And as I said, for example, the CT and MRI reports, we view them online. The patient need not go back to the hospital to fetch the report. And this is again one of the important operative strategy which needs to be used. But you may be wondering that every day the nodal village changes. How is it you are able to have this computer connectivity? I'm so glad to tell you that it is the village boys who have been trained. Every day they create an intranet using Wi-Fi, and the whole work is computerized. This has been done from 2014 actually. Because when we started the mobile hospital, I was very clear in my mind that it has to go through 3 or 4 phases. The first phase was setting it up, starting it, running it. The second was streamlining it. The third was stabilizing it. As Swami says, if you hit a nail, it should not move, it should be so firm. And the fourth stage was of diversification. So I thought, let the service first start, let things stabilize, get streamlined, let people start coming, let the beneficiaries visibly, palpably, they feel the benefit of it. Then we'll go about these tasks. And as you know, we have a very good IT team which has helped us. And we have data right from 2014 on so many aspects of patient care. The next strategy is nothing but reiteration of the operative theme, which I said, but I have again brought it out because Bhagwan was very insistent on prevention. And he said once when we had an interview with Bhagwan after a village service, he said, in your village service, okka vyakti, one individual, if you can motivate him, not by your speeches, but by your exemplary service. And then he said, you should go to the extent of card patkoval. You should touch his feet and plead with him to stop smoking or alcoholism. He said, if you can do for one individual in that village, take it from me, your Grama Seva is a success. So Swami was very, very insistent on preventive healthcare. So right from the beginning, health education became an essential, integrated and important component of the mobile hospital service. And we started doing it both intensively and extensively. And we identified 5 main topics. 5 main topics. One was hygiene at 3 levels: individual hygiene, family hygiene, and community hygiene. Second was nutrition. Third was, as you know, these lifestyle diseases. And fourth was the ill effects of alcoholism, smoking and all. And fifth was nutrition, teaching them how to make nutritious recipes with the ingredients available at home. So these 5 topics we selected, and we started doing health education. Again, when I talk of innovation, there is a method for everything in this world. When you do health education, it has to be done at 3 levels: individual level, family level, and community level. So that the entire cross-section of the community is taken care. And first, when I was coordinating the mother and child health care, pregnant women and small children, I used to go out to the community in the evening and have these audiovisual programs. So one group of doctors who trained our gynecologists in cancer cervix screening, they asked me, why is it these pregnant women, when they come, you can educate them? I said, no. If this pregnant woman has to follow the guidelines which we give, she needs the cooperation of her husband, her father-in-law, her mother-in-law, and not only that, an individual in a community right now, his wife may not be carrying. After a few months, he may get married and his wife will carry. So the awareness has to be created in the whole community for any health education program to succeed. So that is why we devised this individual, family, and community level of health education.
Along with a few doctors, they go into the village and inspire the villagers to adopt hygienic living. This is a very unique practice that brings the entire village together as one family.
So, as I said, when you are entering and penetrating into the community, when you are doing a good curative service, you are placed in a huge advantage. You should use it to your advantage. You should exploit the situation. And that is why when we conduct a community level program in a village, the whole village literally assembles. Of course, there were some innovations. Yesterday, I was describing how to attract the different sections in the village, children, for example, or women or elders, how we showed them some devotional programs also. But as I said, health education programs in government fail because curative and preventive care are isolated or separate. The preventive care is done by, health education is done by not doctors, but they call A&Ms, and they go at a time when the villagers have already gone to field. And even if they create a community, if they arrange a community level program, I have seen many villages, government also has tried, but hardly there are a few people who are sitting. So anyway, these are lessons which we have conveyed to the government, and the government has taken it in a very positive way. Another aspect of prevention, which my doctor colleagues would know, is what is called screening service. When we listed out the different categories of ailments, we had one category called asymptomatic ailment, where the individual will not have any specific problem, but he has a disease. And it is your duty as healthcare planners to unearth this hidden treasure of diseases, what I call the tip of the iceberg. For this, we do what's called screening program. And one very important screening program in which we have been a huge success is cancer cervix screening. And it is not only screening, but we call it cancer cervix screening and treatment. This is what attracted the attention of the NGO who came from US, PINCC, Prevention International No Cancer Cervix. They're a huge organization. They came, and when they revisited our screening service which we were doing, they said this is the only center where we saw that after the screening, we also do cervical biopsy and send it for histopathological study. And if the biopsy shows changes for each of the levels of what we call CIN, cervical intraepithelial neoplasia, there's a particular way of treating. We treat them also. So they said this is the only center where not only screening, but even treatment is done. And we realized that this would be successful only if it is a component of a comprehensive kit of medical care which you are giving to the community. If you do it in isolation, like many organizations have vans which do cancer breast screening, cancer cervix screening, it doesn't have receptivity because the villages are not even an average, even a city-based woman may not be really, willing to have her, she's quite okay. So when you fit into the kit of complete medical care, and you tell them that it is better these ailments are caught in the early stage, there is a huge receptivity. We have come to a stage where women come and ask, cancer ki kade test chestaranta kada, they do a test for cancer. You know, these are some of the lessons which emanated from this project. And finally, the important operative strategy is, yesterday also in Dr. Kalpalata's house, we had a brief discussion. Swami was very particular of this aspect of health, spiritual dimension, and it doesn't pertain to any religion or cult or any sort of a personality. It only refers to our age-old tradition, our age-old practices like prayer and meditation, which are common to any religion. And believe me now, medical science has emphatically proved, the National Institute of Mental Health and Neurosciences in Bangalore, they have clearly shown that it is our thoughts which determine the function of an important endocrine gland called hypothalamus. And this hypothalamus is something like bandmaster, it dictates the function of the other endocrine glands. And if you have negative thoughts, hypothalamic function gets deranged, and this is reflected in deranged function of adrenal cortex, the gland which produces steroids. And steroids level, if it rises, it has been clearly shown, it is not only immunosuppressive, but what we call mitogenic. It can trigger off cancer also. So that is why Swami, when he once asked us, how do you define health? When we gave some World Health Organization definition, he said, no, I'll tell you. He said, Arogyamo 5 vishayalapaina aadharapadindi. 5 components make up human health. He said, Ahara, the food which you eat. Vihara, the places where you go or the physical exercise which you do. Achara, your conduct. Uchara, the way you talk. And finally he said, Vichara, your thoughts. And he said the first and last, Ahara and Vichara are the most important. And now believe me, my dear friends, medical science has emphatically proved that to call somebody that is in a state of real, complete health, these two components, what is called metabolic health and mental health, are very important. And this metabolic health depends on the food, what we consume. Mental health depends on our thoughts. What our master told so many years back is now being unraveled again by medical science also. And as you know, when you have this sort of an arrangement where the service is regular, serious, sustained, you have very good doctors, you have on-site diagnostics, you have good medicines, you have a mechanism to take up cases which require surgeries or things like that, automatically an academic environment gets generated. The mobile hospital became a huge gold mine of clinical material. Any disease, call it by any name, you will find a patient in the mobile hospital. So an academic environment got built up, and can you believe, it did not immediately attract the attention of our Indian medical colleges or doctors. It attracted the attention of Cambridge School of Medicine, which I came to know only later, that Cambridge School is always one of the 3 in the top list of the best medical schools in the world. And they pleaded with Swami, we will have a memorandum of understanding, we will send our students for their electives, the final year medical students, or even postgraduates.
The Faculty of Clinical Medicine in faraway Cambridge University sent an intern, Stephen, who went along with the hospital team and presented a much appreciated report.
And then the Dean of Medicine, Dr. Jessica, wrote a report. My father-in-law worked in London. He says no Britisher will take his pen and write something good unless he is more than 100% convinced. And what she wrote was, this is the best ever training which our students got, because every year we send them to different locations. And the techniques which you use to deliver that academic course is something, lessons we have to learn from you. This was indeed, and when we showed it to Bhagavan, Swami was immensely pleased with this. So these are some of the statistics, But you can see the daily statistics. Every day we do about 20 to 30 X-rays, about 20 to 25 scans, and pregnant women especially, as you all know, during the 20th to 22nd week, they need a special scan called anomaly scan. And previously, the general hospital pregnant women in the antenatal clinic were being sent, because we don't have a department of radiology there, to Anantapur, to private hospitals. They used to spend money, sometimes sleep in the bus stand in the night because they did not get the appointment. And when I took over as the head of the general hospital, I immediately diverted all these pregnant women to the villages where the mobile hospital comes, which is also quite close by. So the ultrasound facility and the 2D echocardiogram, which is done to determine what we call cardiac function, LV function prior to surgery, fitness, is also done on the field only. So it's a high quality care. Lab tests, as I said, we did a small innovation for tests which cannot be done on the field. What we thought was, again, Swami said, Tippo Duwadani. So what we thought, we'll collect the sample, centrifuge it, put it in vacuum and one volunteer takes 25 samples. Instead of 25 villagers going to a hospital and losing their daily wages, one volunteer does that work. And this is innovation about which we'll conclude in our concluding remarks. If this was the broad outline of the mobile hospital, which I had given you, which has so many really highlighting features, still I thought there are 2 or 3 points which are really the highlighting features, and what is the message they convey to all of us. The first is, the whole service is maintained totally by voluntary doctors, and none of the doctors are paid anything. Of course, they come for 4 days, not even their transportation charges. Only when they come to Puttaparthi they are given accommodation and food. And this number has never dwindled. It has been always on the increase. And as you can understand, an economist like my son-in-law Ishwar would say that when you don't pay salary to any of the skilled manpower especially, your expenditure under salary head would be 0. So Swami was very happy that 80 to 85% of the expenditure, the amount, the money which is spent, goes for patient care, not for salaries. So now the question arises, what is it that makes these doctors to come for service again and again? I am telling you with all sincerity, I must have interacted over telephone with at least 3,000, 4,000 different doctors. Believe me, not a single doctor told me that he would be coming or he is not interested in coming. They would only ask for their convenient dates or rescheduling their works back at home. So there is an inborn urge, an inborn instinct in each doctor, or for that matter, every individual in the society. There is so much good in the society also. The newspapers or the mass media, they portray only negative things. There are so many good things also which are happening. So this inborn urge is there. But then, if these doctors or if these skilled people want to render service to the community, people like us, the organizers, should create the right platform where they can come and give expression to that inborn urge. And this, I always call it as the technical ambience which you have to create. As I said, when you have diagnostics, when you have a sincere follow-up, every doctor has a register. The previous visit, what all patients he had seen, what all action was taken is written. So when he comes back, he feels happy that justice has been done to the patient. Any amount of your giving mementos or bouquet, nothing is going to work. It is only if you can create this technical ambience, make them feel happy, and believe me, even when Bhagavan was physically there, only 50% of them were knowing Swami or so-called devotees, what we call. But many of them were doctors in Hyderabad, where I said, if you generate service, your team improves. And these were the doctors who were coming for service. So the onus is on an organization like Sri Sathya Sai Seva organization, started by the Lord of the Universe himself, to create such outlets, such platforms for people to come and render service. I know it's a difficult thing. And in my experience, there are doctors, hundreds of doctors willing to come for service. But somebody who can take the mantle on his head, Talamida Petkoni Chayali, Swami used to say, you should put the load on your head and do it. Such type of individuals are lacking in the community, and we can't blame them because every individual has a family, has a career, and Swami never likes anybody to have it disturbed. But anyway, that's entirely a different topic, how we can do it. So, the previous slide. The second highlighting feature, especially since this audience has a good number of doctors especially, I wanted to show you all, is the integration of the 3 levels of care which takes place. I think even in this country, or for that matter in an urban setup, if a patient goes with a particular problem, and if that problem doesn't pertain to that doctor but to that level of care, he or she is only directed to go to some other center. And always it is so painful for us to go to a second hospital. But here is a system wherein if you come to the mobile hospital, if your problem is of a higher level, the onus, the responsibility is taken by the system. And the patient is not, Swami said, "Meeru higher center and pampikandi, higher me, higher." He said, "Are you going to send them?" So, this sort of integration of primary, secondary, and tertiary care is something which I myself realized after a great period of time. And when I made this presentation in an august audience of Indian Medical Association of all the doctors of the country, when I showed this and I told them, do you know that there are not only 3 levels of care, there is a 4th dimension of medical care, and that is outreach care, which has been devised by the Lord of the universe. There was a thunderous applause, and many doctors came to me and said, this is some secret which you have revealed. And one IAS officer who came to the village and saw me, and when I made this point, he said, now I feel all the planning which we did for so many years after independence, it's all a waste. We have gone totally in a wrong way, in a different way. So that is the beauty of this, integrating the 3 levels of care. And as I said, it is the 4th dimension of medical care. And the other highlighting feature, which I have been repeatedly telling, is the holistic health care. A complete health care, curative, preventive, and spiritual. These are the highlighting features of the mobile hospital. We come to the final section of my talk today. As I said, this is very relevant for our Sathya Sai Seva organization. What are the lessons which are emanating from this? A service which has been started by the Lord of the universe itself. And as I said, these lessons are common for any service being taken up. It is not only a medical service. The first thing is evolution of Seva. As you saw, Swami, how in a sequential way, in a planned way, the service of even started by Bhagavan Award. It started in 1950 with primary and to some extent secondary care. 1980 took 30 years, the tertiary care, and then in 2004, So when Mr. Nagarajan told me that initially, sir, there were only 4 families in the center, but now we have grown to a number of 70 to 80, I was so happy. Everything has to evolve. Because Swami once said, even in spirituality, revolution kaadu. He said, don't overnight become a sannyasi and grow a beard and try to do some meditation. Evolution. Everything in nature evolves over a period of time. So, as I said, even when you start a service, you have to start it in a small way. And there are 2 again important reasons. Firstly, the members of our organization, as you know, we are all grahasthas. We are not sannyasis or saints. We have our family. So we have our limitations also. And second, an important guideline, not a guideline, it's mandate. We are not supposed to solicit funds. So you cannot start a massive project by collecting money from so many people. Because Swami once told us in an interview, Mukuru Naluru, 3 or 4 of you should do sacrifice. Tan, man, dan, mudu. 3 you have to do, start a service. And when it is done with that pure motto, with a transparent motive, and when you generate that service, people, the world has so many good people who are willing to help such projects, they will rally around. But you should not stagnate, you should not become static, you have to expand it. And your sacrifice, the 3 or 4, should continue. And when it expands, more people join. So the evolution of Seva is the beautiful spiritual secret which Swami gave us. But at no point of time, remain content with the service which is being done. You have to expand. Because as I said, being static or stagnant is very little. And how you increase it, how you expand it, diversify it, as I said, common sense, intelligence, and conscience. The next is the service should be, Swami was always very particular, a need-based service. That is, it should tally with the requirements of the community. Just because if you have something in excess, like doing some random food distribution, good exercise, I'm not saying. But it should not stop there. It should be the beginning of building up your team strength. Like for example, I'll tell you one instance. In Hyderabad, where I used to stay, in the neighborhood, there is one school called Devana School for the Visually Challenged. Blind children, about 150 to 180 were in that school. And every day, some visitor or the other, some rich man comes and says it is his birthday or his child's birthday and his name is written on a blackboard and gives them a rich meal. And every day this was there. So when we went and we were interacting with the children, doing bal vikas and also medical seva, medical checkup, we asked them, I made them all sit and ask, children, now tell me, what is it that will make you happy? Because already they don't have vision. But still, what is it? They said, Uncle, please take us to a place. Here, when we have to walk, what they do is, one child with a little vision will lead. The others will hold the, hip raise and they walk in. Wherever we walk, we are always afraid we may collide with a pillar or a wall. So take us to some open place where we can just run and run and run without any fear. So what we did, we arranged a bus and took them to a big park, like our urban park, what we have here, called Sanjeevaya Park. And we have our traditional way, beautiful way of doing. Children received them with Veda chanting, and then we served them breakfast, and then we lined them up, about 70 of them. And it's a big park, very big park. We told them, we'll say 1, 2, 3, and when we say 3, you can run. And believe me, they ran and ran and ran. They were panting in the end. So, it is not that, you give these children the best sweet, the best every day. And they told me, sir, because of this we are having diarrhea. And the woman who used to take care of the restroom, washroom and all, she used to say, that's so difficult because these children, if they have diarrhea, they don't have vision. And it's so difficult for me to clean. So, at any point of time, remember, our service has to be need-based service. Swami realized the fact that even though he has set up a general hospital, super specialty, still it is not meeting the needs of the needy. And thereby he did this innovation. And can you believe me, this innovation of mobile hospital was visited by the scientific advisor to the Prime Minister of India, who is also the scientific advisor to the Government of India, Professor Dr. Chidambaram. Not the politician Chidambaram, there is one more Dr. Chidambaram. And do you know, when he came and saw, the next day he was asked to speak in the university and the topic was innovation. He said, you are asking me to talk of innovation, what can I talk? Yesterday I saw the most beautiful innovation which has been made by Bhagavan, when quality rural healthcare is delivered at or near the doorstep of the villages. What more can I talk? So this is the lesson, that our service which you start, please do a comprehensive exercise to determine the needs of the community or to those who are really deprived of many aspects of normal living, and then plan your services. We do Narayan Seva, we do all these things, it's all good, but definitely we need to do services which are what Bhagavan calls need-based. And as I said, in Seva, always you have to innovate. Innovation means trying to find a solution which would be different from the routine way of doing a particular thing, like the way Bhagavan did. And again, for example, I'll give you one more example. In the mobile hospital, can you believe, you had seen the first slide, about 500 to 600 patients come every day. And with one attendant, we call them attendant, the mother or father, about 1,000 people are congregating in a small village school of this size. That will be only confusion and chaos. So we really thought over the matter and we innovated. We went by the British policy of divide and rule. But we thought it would be divide and serve. So what we did was, we sketched the mobile hospital into 5 different sections. First, the reception section, where they received love. Then a register where triaging is done. Like somebody with orthopedic, ENT, we form different rows And from that group, 15 of them are picked up and taken to that respective specialty. The next level where a computerized registration is done, just outside the doctor's consulting chamber. Some of our doctors have visited the mobile hospital. The third level is the doctor's consulting room, where also Swami was very particular that Gauravanga treat cheyali. You should treat them with respect. Edo freega meer chestunarani itla raasi pampattu. He said treat them with respect. So at the initial registration section, we have only carpets, we have 300, 400 will be there. At the registration section, we have benches, and when they come to the doctor's consulting room, 2/3 of the room is demarcated for the doctors, 1/3 we line up about 10, 12 chairs and make the villagers sit. And sometimes they hesitate to sit, they said we'll sit on the ground. So rustic, so innocent are these villagers, and they can't imagine that such a high quality free service is being given, of course, only possible by Bhagavan. It cannot happen anywhere in the world, I think. So anyway, this sort of an innovation. The fourth section is the diagnostics. The bus is parked a little away from the school, so that that crowd doesn't get mixed up with this. And again, at the exit point, you have the pharmacy. So what you're doing, you're dividing the crowd. Divide, not rule, divide, serve. This is one innovation. And one more small innovation which we did very recently, it was the 20th anniversary of the mobile hospital. As you know, anniversary doesn't mean garlanding Swami or having only bhajans and some feeding and all. But we thought we should do something new, something. So automatically when you think of such a project, there are three players in this, stakeholders if you can call, patients, doctors, and the sevaks. So for each of them, some new addition let us do. And for patients, as I told, who are given 1 month medicine, as you know, they have 5-6 medicines. And each medicine is about 60 tablets. So we used to put in covers and give them. Always I used to feel whether they are using it at the right time, the right dose and all. So we made a small innovation. Next slide. We are now giving them 3 boxes. One box, they are big boxes which can accommodate 5 different medicines, each of them about 50-60 tablets, with the mark of sun. So it means all the medicines in this box will be used by them in the morning. The second box is the moon. The third box, you may ask, what did you put? We told them if there is no sticker, it means you have to take it in the afternoon. Such medicines are not many actually. Believe me, this single act generated such a goodwill, not from the patients, but from our doctors who are coming for Seva. They said, sir, if you are taking care of such minute aspects, we feel we should strengthen your hands by coming regularly. This is what one Dr. Rambabu, an eminent physician in Hyderabad, he messaged to me. There's one more Dr. Rambabu in Hyderabad, ENT surgeon, but this gentleman is a physician. So, innovation in service, whatever seva you do, you have to keep on thinking, and as Bhagavan rightly told, I would repeat again and again, use our common sense, intelligence, conscience, never feel satisfied of anything that is going on. Always try to do, and for that you should have a think tank, however small your samiti may be, about 5 or 6 members, who constantly are thinking over how to improve. They may be having other family, but still, as I think I am going to conclude, I will not hold you back, but I think it is relevant to bring out this point. Yesterday I was telling to Dr. Lavanya, in one interview, one young man told Swami, నాకు సేవ చేయాలని ఉంది. I want to do seva, but I don't have time. I am working in a software industry, there is no time. Then we know what Swami said. ఇవి ఉత్తి మాటలు, ఇక్కడ నుంచి వస్తుంది. These are empty words coming from here. ఇక్కడ నుంచి కాదు. It's not coming from here. He said, నువ్వు నిజంగా బాధపడ్డావా? Did you really feel bad? నాకు సమయం లేదు, సేవ చేయాలని ఉంది. I want to do seva, but I don't have time. నువ్వు నిజంగా తపన పడ్డావా? Did you yearn for it? I want to do seva, but there is no time. నువ్వు నా ఫోటో ఎదురుగా కూర్చొని ఏడ్చావా? Did you sit in front of my photo and cry? నువ్వు చేయలేదు. నువ్వు అది చేసి ఉంటే, if you have done that, నేను నీకు సమయం క్రియేట్ చేసేవాడిని. I would have created time for you. And then Swami said, నేను కాలాతీతుడిని. I am the overlord of space and time. And believe me, yesterday when people were asking me, I really did not sort of ignore my children. They can testify to what I'm saying. I really took care of my family also. And I was working in government. But when the load became heavy in 2004, I told Swami, Swami, the joy which I'm getting now sitting in front of you, because believe me, Bhagavan, when you see him from closely, he's such a power. It was not like his photo or the video which you see. That aura, that power is so tremendous. I told him, Swami, the joy which I'm getting now, the same joy I get when I go to villages and do Seva, because you have given us the Taraka Mantram, the secret. He said, Grama Sevaye Rama Seva. If you do Grama Seva, it is doing Seva for me. So, Khani Swami, I am not able to balance my family, my office work, my hospital work, and my Seva. I'll resign my job, Swami. Then he said, can't you do Seva while working? I said, no, Swami, my health is getting upset. Health should not get upset. Then, of course, Bhagavan did like this, wrote something, then he told me, resign your job and come. So, what I'm saying, at no point of time, even after becoming the director of mobile hospital, I used to be away from Hyderabad for 2 weeks. Now it is totally, I'm in Puttaparthi. But I never neglected my family or my wife or children. And Swami, of course, told that he would take complete care. The divine grace is always there. But still, at the human level, he likes us being intensely practical. So there were times when perhaps they would have missed. In fact, these two children, Sathya Sai and Prem Sai, who were interviewed by Radio Sai, when they asked, don't you miss your father during Deepavali or your mobile hospital? No holiday. 2 weeks, let it be Christmas or Deepavali. Don't you miss him? He said he more than compensates in the remaining days. So, what I mean to say is that we need not ignore. If we have that yearning, Swami called it tapana, and that prarthana, prayer, and if you really feel bad, I want to do Seva, I am so sure that he will open up all avenues. And this is written in what is called that Swami series of books, where Swami says, when a devotee comes to me and asks for Seva, I, in discharge of my duty in this avatar, he says, in discharge my duty, grant Seva to that yogi. Swami calls him yogi even before he has done it. That thought itself is enough to please our Master. So we need to have that prayer, that yearning, that tapana. And as I said, the think tank. We need to have 3 circles of devotees in any samiti. The first circle will be those who are totally sort of intensely dedicated. The second group is when you give them some responsibility, they will do it. They will be prepared to share the responsibility, but they can't be totally involved. And the third circle is one on the day of activity. You require 30-40 people for a medical service, they come. People are at different levels of evolution, different levels of commitment. So it is not proper for us to really say why you are not coming, why you are coming and all. It is we, the organizers, the samiti heads, the think tank who have to devise ways. In fact, in Sundaram, as you know, Chennai, Mandir, they have these 3 levels of singers. The innermost, they sing when Bhagavan comes, or very special birthday. The second one during Thursdays and Sundays. The third circle, everyday bhajans which take place. So as I said, innovation in Seva is critical. And for this...
It was like a strategic plan.
1 minute. This lady who is talking, can you believe she is the Chief Secretary of Karnataka government? Chief Secretary is the administrative head of a state, IAS officer, and she had been to our mobile hospital. You can listen to what she's saying.
It was like a strategic planning. Every single item was available. The way they set up the equipment in different rooms, it was like a mini super specialty hospital. And the icing on the cake was the availability of medicines. Usually somebody would prescribe something and go off, but here it's not limited to that. After that, the people come, they get their prescriptions, they come and get the medicines. And the best beauty of this this entire exercise is that they know exactly when the hospital will reach them and when is the next visit, and we were told that it has never failed. Come hail, come shine, whatever, the hospital comes. And every single person who was a part of this entire project was an epitome of love, compassion and care. It couldn't be better. This is a model that can be replicated. It's the public service of the highest order.
In 2014, the mobile hospital.
Innovation and Seva. Last point. I will not hold you back, only one more point. The lessons of Seva, what we do. Like the Seva which we do, Swami always wanted us, it should be a model for the society, for the government, for the community, for other NGOs. Like, as I said, the outreach service which Swami had started has now come to such a stage that governments both at the center and in the states are in touch with us, discussing with us. And I'm so happy to say that the Andhra Pradesh government is going to start 5 pilot projects, and the funding is going to be done, the capital expenditure, by Tata Trust. Tata Trust has never entered with Sathya Sai organization because they believe that nothing can be done free or a sustained period. That is some principle they have. Otherwise, Tata Trust is one of the most noble trusts. Even they had Tata, when he came, Bhagavan had received him with so much love. But now Tata Trust is going to. So the point came to the government. The government always has difficulty getting doctors, as you know, doctors who will go to villages and all. So we gave them a very innovative solution. We said postgraduate students, those who are doing MD, MS, DM, MCH, during the second and third year, they should be drafted into this. And when I told Dr. Suresh Chari, he said, yes, definitely, because the clinical material will be huge. So anyway, what I mean to say is that the Seva which we do should be a model for the world. It should bear the stamp of Sathya Sai Seva. Then it becomes meaning it would make our master happy on the one hand, and it would be, as I said, palpably, visibly useful to the community. You should not do something which generates happiness and joy for you. Yes, that also is important, but it should be useful to the beneficiaries. And finally, after that, award which Madam had mentioned about it, I will just show that clipping and then we'll conclude. Okay, if it is difficult, we'll leave it.
No, just give me one moment. Just want to go to slide 2.
It was like a strategic planning. Every single item was available. The way they set up the equipment in different rooms, it was like a mini super specialty hospital. And the icing on the cake, it was like a strategic planning. Every single item was available. The way they set up the equipment in different rooms, it was like a mini super specialty hospital. And the icing on the cake was the availability of medicines. Usually somebody would prescribe something and go off, but here it's not limited to that. After that, the people come, they get their prescriptions, they come and get the medicines. And the best beauty of this entire exercise is that they know exactly when the hospital will reach them and when is the next visit. And we were told that it has never failed. Come hail, come shine, whatever, the hospital comes. And every single person who was a part of this entire project was an epitome of love, compassion and care. It couldn't be better. This is a model that can be replicated. It's the public service of the highest order.
In 2014, the mobile hospital was adjudged as the best in rural outreach healthcare and received a citation which read, "Transformation of Human Lives with Innovative Healthcare." This was a special award by CNBC TV 18. It screened 3,000 hospitals in the country and gave awards to 12 hospitals.
Okay. Finally, I would conclude by pointing out that whenever we create a Seva model, it should be something which can be replicated without much difficulty. As you can see, in any healthcare service, we doctors, we call the 3 Ds are important. Doctors, diagnostics, drugs. And the fourth one which we talked about, which is very crucial for a country like India or where communities are cut off from the mainstream, is the delivery system. But in addition, there is one aspect of work of the mobile hospital which is very difficult, and that is the logistics. Every day you need to create a mini hospital. So I was thinking that if my successor comes, he would really find this model a bit unacceptable. And to other organizations or even the government, they may find it difficult. I was praying hard, and I'm so glad to tell you that technology about which I was talking is helping us so much. Now, a manufacturing unit in Hyderabad has started making buses which are of a different type, where you have a static portion and after parking an expandable portion. So 4 consulting rooms are there. Everything is fixed like electricity, air conditioning, a washroom, the equipments, everything is fixed. You just need to go there and render the service. And outside each of the rooms, they will have tents, which they themselves by some pump mechanism, the tents are set up. So this is going to be, I really pray to Bhagavan, it happens. The centenary celebrations were offering at the lotus feet of Bhagavan. And I think it's not wrong if I mention the name of one of your devotees here, Mr. Shankar Planjeri, who has been given the opportunity to fund the new bus purchase, which costs about 2 crores in Indian currency. And this clip we'll just see. And so anyway, thank you all for your patient hearing. I again thank Bhagavan and the organizers, and especially Dr. Kalpalata, who gave me the thought that I should speak on this unique project of Swami, which is not well known. But then, as I said, innovation I've been talking about, I thought I would innovate a little further and try to cull out the lessons which emanate from this beautiful innovative project, which will be relevant to any service project which you may be contemplating to start. I also thank Mr. Nagarajan for giving me this opportunity and all of you for your patient hearing. Thank you so much, sir.
Sarah, the session is open for some questions. If you have any questions, we'll be happy to pass them out there.
Sorry. Just switch.
Saya, thank you so much. That was very impressive, very moving. Thank you. Almost like Swami speaking here. I know that you have mentioned and Swami has mentioned that these are opportunities for devotees, that is, volunteers, for their spiritual evolution. In your experience of working with so many doctors, what can you tell us about the transformation of the physicians and the volunteers during the process of Seva?
So your question is very appropriate. As I told you, the one transformation which they always say is, we are motivated to come again and again. And we have now come to such a situation where it has become a sort of an addiction. Like each doctor gives his frequency of coming for Seva. Some say once in 3 months, some say every month, some say 6 months. They all say that if we come here and serve, it is nothing but really, they say, a charging of our batteries, and we do our work better there. And there are again 2 or 3 small things which many doctors told me. Like what I do, especially for patients who are a little more illiterate and where the medicines need to be taken properly, I ask them to bring the medicines to my table, and again I will explain to them. And as I was mentioning yesterday, I always take that opportunity to tell them to take the medicine, taking God's name, whichever God you chant. So they said that this sort of a thing, it did not strike to us. Like in our hospitals, the pharmacy issues the medicines and we really don't bother. I think the pharmacy system here is very solid, but in India it's not that. So, they say that we have learned certain new techniques. And when I told them that after all, coming here and serving is a very good thing, where the Lord of the universe himself had taken a human form, but still back at your ends also, if you can start some similar services. So what many doctors have done is every month they allocate 1 day. I told them it may be your birthday or your wife's birthday or a child's birthday. That day, the treatment in that hospital is totally free. And some of the beds also they earmark for that. And especially one orthopedic surgeon by name Dr. Surender, every 4th Sunday he is an orthopedic FRCS surgeon. He identifies patients with post-polio or whatever be the cause, deformities, and he admits them and does surgery. So for the last 13 or 14 years he has been doing this service. So what I mean to say is coming here motivates them to do service back at their ends. And at an individual level, I am sure their evolution on the spiritual scale would definitely be high. And we all have experienced that, and that is too personal to tell you. But definitely the transformation comes, and we also encourage them to, at their ends, to join with the Sathya Sai Seva organization, local branches, and whenever they do such service.
The only other question I had was regarding telemedicine and whether that facilities are available in the mobile hospital.
Telemedicine.
Yeah.
See, telemedicine, we never felt the need to have some sort of a connectivity and a service, because on the field itself there are 10 or 2 specialist doctors. So all varieties of doctors are there. Can you believe even cardiologists, neurologists come not all the 12 days, but about 4 days every month. So when there is such an availability, we never felt that the need for telemedicine.
Thank you so much. Amazing and very inspiring work. Have you looked at the outcomes in terms of public health? Is my question. Villages that don't have this access to your mobile service versus villages that do. You've been doing this over a long time. I'm sure there are differences in the health indicators and determinants. Has anyone?
Yes, like we are so much geared up with patient care. We would like to use all the time that is available for the patient. We really, from our side, consciously we have not entered into a sort of doing a research work on this, but definitely there are so many indicators. Like for example, the gynecology department which does the cancer cervix screening, they might have screened till about 25,000 or 30,000 women. So they tell me, Dr. Narasimhan, previous days, every month, suppose if we screen about 150 women, at least 5 or 6 reports used to come as what is called CIN3. But nowadays we hardly get one such patient. And the reason for this is the relentless health education done on aspects of things like menstrual hygiene and all. That is one area. Second, our ophthalmic doctors, like all diabetics, every 6 months, we do them a retina check to rule out diabetic retinopathy. If it is normal, we do it only once a year. Similarly, for diabetic nephropathy, we do a test called albumin-creatinine ratio, ACR, to find out early nephropathy. So they told me that we are so surprised to see that many of them who had diabetic retinopathy, the first or second stage, it has got reversed. And they said that even the number of new cases of diabetic retinopathy are not seen. And they said that maybe because of good glycemic control, good blood sugar controls. And one main reason for that is the supply of medicines. As I said, the uninterrupted supply of medicines, which is crucial to ensure that they have glycemic control. And again, on aspects of other aspects like prevention, like it may be news for you that in Indian villages they don't have sanitary toilets, they go for open air defecation. And there are so many villages where when we went, for our doctor's sake at least, we used to ask them, do you have a washroom or this? They have never had. But these villages now, it is 100% conversion. And one village group especially told me that the government gives a subsidy for that. When they went to the revenue divisional officer's office, he told them, it seems I had visited your village 2 weeks back, I had given a talk also, but none of you responded. What makes you now to come? So many of you are coming and asking for that subsidy. They said, sir, it is because of the good medical service which is done by the mobile hospital. So again, it reinforces the message which I tried to bring out, that if your curative care is strong, people are prepared to listen to you on aspects of prevention. And not only that, in the dental department, for example, they used to tell me, sir, our patients are really, we should say, we are come to do service only, but they all have foul odor emanating from the mouth, halitosis, what we call, and that is because of periodontal gum infection. But now, sir, hardly a few have halitosis. That is again because, so the improvements, parameters, and I am sure, like even on the curative front, definitely, the cases of diabetic nephropathy, retinopathy, all these are coming. So the effects are felt both on the curative and the preventive aspect. And the spiritual dimension of health also, I am so glad to tell you that we have about 30,000 books of what we call Likita Japa, writing God's name, written by patients and who have brought and given it back to us. Because for patients with chronic ailments like diabetes and hypertension, we tell them that a tranquil mind is important for better control levels, and hence practice this. You may write the name of any god you wish to say. So definitely we have found that blood pressure controls, blood sugar controls are better. So the spiritual dimension of health, because Swami ultimately said that this Seva, Grama Seva is Rama Seva, why I am telling, is Lord Rama, the Vanaras who worked with Lord Rama. Their work was not just finding out Sita and restoring her back to Lord Rama. It was for Dharma Sthapana, re-establishment of Sanatana Dharma. And Swami said even this Grama Seva, village service, is not just for improving the socio-economic status or removing the ailments. It is to convince the villagers of our pristine Indian culture. And Swami said, ఇప్పుడు కూడా ఆధ్యాత్మికం మిగిలిందంటే గ్రామాలనే ఇంతో అంతో మిగిలింది. Even now, if spirituality or our culture is left, it's only to some extent in village. కానీ ఈ టీవీ వల్ల, కంప్యూటర్ వల్ల, మొబైల్ ఫోన్స్ వల్ల చెడిపోతుంది. So మీరు అక్కడ వెళ్ళి, because of these influences, it is getting eroded. You have to go there. మీ ఆదర్శమైన సేవతో, with your exemplary service, వాళ్ళ మనసులో నమ్మకం కలిగేయండి. Create faith in their mind, and then when you talk of God, they are easily prepared to take it up. So as I said, this holistic health has had impact on all the three fronts.
A quick follow-up question. What is your monthly budget?
Yes. So the monthly, as I said, the expenditure under salary head for doctors is 0. And there are about 40 volunteers. In fact, there are about 12 village youngsters whom they are so good now. Yesterday we were talking, I think, with Dr. Suresh. They are so good. They can do suture application, suture removal, POP application, bandaging, all these. Each department. There is one village boy, if suppose the PTINR test which we do for anticoagulant monitoring, if suppose some doctor by mistake, if the PTINR is high and still he said continue the same dose, he immediately brings the book back to me and says, sir, I think it was not appropriate. So then I reduced those. So each village, so these 12 villages after 2-3 years, I felt that they should be compensated, given some honorary. So, I told Bhagavan, Tappaka, Ivali Manu. So we pay some honorarium for them. Apart from that, remaining 28 or 30, they serve voluntarily. Many of them came from Hyderabad. Just when I got transferred by Bhagavan, they also got transferred to Puttaparthi following me. And 1/3 of them are natives of Puttaparthi. So that being so, the total expenditure, as I said, 80 to 85% goes only for patient care. And the amount which is incurred, the main heading is medicines. Second is fuel cost. Because the service itself is outreach, we have 4 vehicles which go. So the fuel cost. And third, of course, there are other costs, but not like a static hospital which has to pay for electricity, which has to now pay for a watchman, building maintenance, fire hazards, some fee they have to pay to the government, all these. So the overall expenditure per month is about 6 lakhs Indian currency. So it works to about 72 lakhs every year. And in this, as I said, the daily outpatient number of patients coming is 500 to 600. And as I said, it's a complete quality care. It's not just. So if you take the cost-benefit ratio, it really works out very favorably. And in fact, our Sathya Sai Central Trust feels that least expenditure, maximum satisfaction, they say, our trustees. And they say this is the flagship project of our Sathya Sai Central Trust, because even when Dr. Chidambaram, I mentioned, the scientific advisor, when he came, he said, we'll take you to super specialty. He said, I don't want to see that. I have seen enough corporate hospitals. We are talking of some village service, but at that time the mobile hospital was not operational. It functions only first to come. So I was asked to make a PowerPoint presentation. And believe me, he saw the PowerPoint presentation like this, and he said, in the end, this is fantastic. And he said, it is not enough if I see the PPT, I'll come myself. And he's a Z security man. Z security man means he's surrounded on all the 4 sides by, meaning security people having AK-47. He spent 1.5 hours on the field. And then, as I said, the next day when he was asked to speak on innovation, he said, what more innovation I can speak. So anyway, the expenditure, as you asked, is not at all high, considering the fact that we give medicines for 1 month, the diagnostics, so many headaches.
The follow-up is...
Dr. Narasimhan, thanks for a very informative talk on the mobile hospital Seva. But my question is related towards the medical camp, which we are involved here. And you used a very good term, like a feel-good Seva. So what are your suggestions that we improve upon them and make more productivity and, helpful to the community?
See, it is not that medical camps should not be done, but they should not be the end all. You can start off with that, but you need to graduate and post-graduate. But still, as I said, even these medical camps, if they have some special focus, like we used to do the medical camp for the visually challenged children, or an old age home. And then there also, even though you may go again after 3 months, you open a medical record and you tell the inmates that if you have any medical problem, call us, at least we'll be able to guide you. And also tell the management, some of our doctors, like in India, they have hospitals, they have clinics where these patients can come. And now, especially the US group, Dr. Geeta Kamath and all, Dr. Akshay Kalatia and all were coming. They wanted to do a medical camp. I said a sporadic medical camp is of no use, and anyway the mobile hospital is working. What you do is one specific activity, which I suggested, called school health service. In the village there is a school, about 200 to 250 children are there, and children, as you know, constitute the priority sector in any healthcare planning. And children many a time do not tell their complaints. Parents are sometimes indifferent or ignorant. So what we do, even in the mobile hospital, once a year we do the school health service. We have a template name, age, height, weight, state of the oral cavity, eye refraction, and then state of the ear, heart, lungs, everything. There are columns. Not only that, we chart out what is called the 3 heads: health, habits, home environment. All the 3 are important. One will impact the other. So the paramedics in that group of sevaks who are coming, after all, as I said, the onus is on the organizers to create outlets of seva. So it is not just you should create work for doctors. There are also volunteers, paramedics. So what they do, they fill up these columns, habits. Like, do you use a paste and toothbrush? Do you have a sanitary toilet at home? Do you pare your nails? Do you use your footwear? This sort of checking by the paramedic system. Home environment. Many of the parents, because of, as I said, difficult agricultural condition, they migrate to Bangalore and do some menial jobs there. So they are not available. So if suppose you find a child is malnourished and you advise them have some nutritious recipes, parents are not there at home, it's the grandparents who are. So one impacts the other. So I told them, we have identified a village called Veldurthi where there are about 250 children. I'm going to help them by giving the template. And in that group, there are 1 ENT doctor, 1 ophthalmologist, 1 dental surgeon, 1 pediatrician and 2 general physicians with about 20-25 volunteers. Also have a computer, you enter the data. And all children who have intricate problems. Now that the mobile hospital is there, you give that list to me so that when we go back, we will take care of them. But if such a mobile hospital is not there, you have an idea whether to get it done in a government hospital or elsewhere. So that what I mean to say, you do a complete job, an end-to-end solution. And I told them at the end of the service, because these overseas doctors, when they come, they always like to give something. So I said, you distribute hygiene kits. Every kit will have a toothpaste, brush, footwear, nail cutter, just to motivate, stimulate children. It's not that you are going to supply every time, but present them with the hygiene kits, and we'll have that day some sports for the children. So what I mean to say is that even this health service, if it is done, it should be to an organized section, a focused work. Like it could be a school, an old age home, or a visually challenged or physically handicapped. Such sort of this, if it is done, I think that would be better. But it's not that we should not do it, but I'm talking of the utility value. Or maybe if you do on a sustained basis, the same nodal village, like every month, once a month you go, do the same work, diabetics, hypertensives and all, you have a complete checkup, you give the medicines for 1 month. So as I said, the 3 Ds, doctors, diagnostics, drugs are crucial. And fourth, of course, is the delivery. Like for example, at home you may cook excellent food, but if you are not clear of the guests who are going to come, or if you want to do some poor feeding, you do not know where you are going to go and distribute, what is the whole purpose. So what is called the delivery system is very important in healthcare.
Sairam, thanks for sharing such a beautiful, innovative and creative model for how the medical service should be. And you mentioned about the monthly budget for this kind of activities. Is there a channel through which we can contribute to the
Yes, as you know, in Puttaparthi, everything is through the central trust. None of us we want to do, or we are authorized also, we don't. So central trust you can donate, and then you can specify, we want this to be given to the mobile hospital. They do that. Or maybe some equipments like Dr. Kalpalta's group, Prashanthi, they have helped us a lot, not only the mobile hospital but the other hospitals. We can identify and that donation can be given in kind. Like Dr. Akshay Kalatia, your medical head of Global Council, we set up an audiology lab in the ENT hospital. So for that lab it costed about 30 lakhs rupees in his currency. He only funded that. So if you can interact with us, we can guide you how to get involved. And that's a good way. And doctors who are here belonging to any specialty, feel free to reach out to me if you want to come and serve either in the mobile hospital or general hospital. Anywhere, we would welcome you with love.
I have a question for non-medical volunteers. I'm not a doctor. So if I wanted, or someone like me who doesn't speak Telugu, wants to come and help, either in the villages with the local hospital or
Yes, there are so many outlets, please. Like for example, registration, computerized registration you can do. We'll make you sit in the pharmacy and those boxes which we have devised now, you will fill up the medicines. And then when you give to the patient, you tell God's name and take. There are infinite areas of this. You are welcome.
But how do we sign up? Like, how do we?
You need to mail me with your brief resume. Yeah, my mail ID, Dr. Kalpalta, will be able to. But please feel free to come, and it is so nice to come. The one important aspect of service, doing service in Puttaparthi, I would tell you, under the Sathya Sai Central Trust and the Global Council, because this is the only organization which has been started by the Lord of the Universe himself. And once Bhagavan said, if you do Seva here in Puttaparthi, he gave the example of Mahabharata, where Lord Krishna, when he was playing with the Gopalas and all, they used to do service for him, and for that, Brahmadeva comes in the guise of some sort of form and tries to test who is this Lord Krishna, and he sees that all the cows are vanished. Then Krishna creates a new set of cows. Then Brahmadeva pleads with Lord Krishna that you have given me the power of Srishti, creation, but it is waste. If only I can do service to the people who are around you, that itself would make me. When Lord Brahmadeva himself told that, the importance of doing service in Puttaparthi, whenever when you come to India, at least allocate a few days and you can reach out to people like me, and we will definitely show you the outlets for Seva. And if you are technically qualified, if you are an audiologist or an optometrist, still better, but for Seva, And yesterday, as I was telling regarding the importance of love in medical Seva, Swami clarified, Nenu love ani cheppedi doctorlake kaadu, it is not anyone who is engaged in healing, he said, healing. Let it be the person who is doing the registration or the person who gives the medicine or collects the blood sample, they should be loving in nature. So for Swami, doctors means he includes all the team which works to heal, to remove the pain and suffering of the poor.
From your experience in 20 years, do you think that the villages around Puttaparthi are the select villages in India where people are not migrating to urban areas because of better healthcare, that they feel it's better for me here than to go to an urban area?
Yeah, it's an interesting question because the university, Sathya Sai University, is now in an exercise, a research project. Firstly, they wanted to determine the satisfaction levels. Second, the out-of-pocket expenditure, what they call, has it reduced? And they are doing this research in association with Indian Statistical Institution. And their preliminary findings, the ISI gentleman told me that in no other public service, we got our satisfaction rate, which they recorded by a very standard questionnaire devised by ISI, Indian Statistical Institution, which has 15 parameters. They said it's 94.6%, the highest which we have recorded. And they said even the out-of-pocket expenditure is very minimal. We'll give you the exact figures. I am so sure that a good healthcare, because this is one area where villages I know for dengue fever, mind you, platelet count falls, and in private hospitals the guideline for us is if it falls below 15,000 or say 20,000, then we need to do platelet transfusion. But in private hospitals they scare them even if the count is 30,000-40,000. And there are instances where villages have told me, we have sold our cattle, we have sold our land. So definitely, this sort of an organized study is being done now. But I can be on the field for 20 years here, and prior to that in Hyderabad, I can tell you a good healthcare service, especially if it is regular, serious and sustained. And especially during COVID time, no other hospital was admitting non-COVID cases. We were the only one, and we were the network of mobile hospital which was guiding the patients in the villages. So definitely all this would prove to be, but as you know, urbanization is the order of the day. Villages also are carried away, enamored by all the, they think it's all colorful in cities and towns. So definitely urban migration is more. That is why India's village population is now 70% as per the latest statistics. It was even more than that. But Swami, as I said yesterday, said brain drain is only intellectual loss. Aite khani. I am not worried. Kani grama drain, villages that they migrate, are the cultural loss. And he said India is the torchbearer for the humanity in terms of culture, which Swami defined as refinement of human nature. And if that happens, then the universal culture itself is at stake. That's what Bhagavan said.
Sorry. Thank you so much. And I have one question.
Yes.
How the public universities and how they are taking part in this like public school and public universities other than Sathya Sai universities? Are they coming and taking part in Sevas?
No, at the individual level they may come, but not as a schools. But medical college, as I told you, students, both MBBS and postgraduate students, come with great enthusiasm. And I had gone an extra mile by visiting some of the medical colleges and making this presentation. And then their professors bring 2 or 3 students with them. And after that, the students, even if the professor doesn't come, they come. But whereas the other schools and all, as a group, they don't.
Yes, awareness, how it is spreading the awareness to the other.
Yes, as I said, it is so well known. Like if you see the data, the whole work is computerized. The software engineer, one Mr. Sumant, who has devised it, if you see what we call the dashboard, there are 10 or 12 different variants. So if you click one, it will show how many patients can have come from each of the big list of patients. There are about 350 to 400 villages every month, patients who come, at least 5 or 10. So definitely the awareness, the goodwill, the utility value, all of them are there over a period of time. As you know, 20 years is not a joke, and that too sustaining it. And there was a time when doctors, when Bhagavan was there, these doctors were made to sit in a very special place called veranda where Bhagavan comes. So they always used to tell me, the doctors are coming for veranda seating, and after Mass 1 they said now it will all stop. But I was so clear and sure that 50% of them in fact did not know much about Swami. It was the urge, as I said, the inborn instinct to serve, which propelled them to come for Seva. And they continued to do it, even though 2011 Bhagavan gave up his body. But now, 14 years after that also, the service is going on with the same, in fact, diversified, expanded form. Thank you.
I have one question. Is this replicated by other NGOs or other organizations which are not Sai?
There are organizations which are doing outreach service, but I have literally examined all of these. As I said, in medical seva, the width is important, the depth is important. More important is the depth. The width and depth of this mobile hospital has not been done by anybody, but we have what is called Sathya Sai Seva organization in every district, in every state, who are also doing, we have shown them what is called scaled down versions of the mobile hospital. That is, your width can be narrow, but depth should be like, it could be only Sri Sathya Sai Mother and Child Healthcare Service. But in that you do a complete job, all the 6 categories of ailments you address. It can be a Sathya Sai rural ENT service. ENT means just going there and doing hearing impaired, you give them hearing aids or you do surgery. Whatever work you do, it will be complete work. And I think from my side, I'll conclude by quoting what Bhagavan said once, which when I heard that, I literally wept that day. Wept and wept. Swami said, "Ee sristilo, in this creation, oka chima, an ant, chimani kuda meeru paripurnanga, in completely, meeru trupti cheste, if you satisfied, name santoshapadipotam." So that complete work, even if you do a narrow width of service, but you ensure a good depth, I think the Sathya Sai Seva organization under our guidance, because we are on the field for the last 20 years, I am also the medical head of the Sathya Sai organization. So I have been visiting some of these places, but time, as you know, is the constraint, and you get really tired out. And incidentally, I'm handling 2 hospitals as the head, so time is always a constraint.
Seva, thank you, Uncle. As always, very inspiring to listen to you. You set the bar too high. Now, before we come next time, we have to innovate somehow. We said that last time also, I know. But we will really try hard this time.
Swami has said patience and perseverance important. So I have to be patient and you have to have perseverance.
Yes, thank you for your patience. But as always, very inspired to listen to you. And there's such a, I think at least 10 bulbs went up as you were talking on innovation. So hopefully we can have at least one implemented next time you come. Sai Ram, thank you so much.
Come again.
Storehouse of ideas, energy, and all in Dr. Kalpalata.
Oh, yes.
You should use her, talents and her ideas. Her ideas are excellent.
Definitely.
Thank you so much. Thank you.